I, Dr. T.C. Singh, Senior Consultant in Cardiology and Medicine of Delhi Heart and Lung Institute, I am going to speak something about the knowledge about understanding the heart attack. So, in this session that I am going to say is its causes and preventive measures needed to avoid a heart attack. Nowadays, we often come to know that a person died of heart attack even at the age of young age, say nearly less than 30 to 40 years. Incidental heart attack and number of deaths due to it are consistently increasing in India. So for understanding is a heart attack and what can be done, the reason behind it that you should understand. We know that the heart is the most essential organ and it is non-stop functioning crucial for survival of the human, and it functions like a pump and allows the circulation of the blood throughout the body. Blood circulated through the extensive network of various types of small and large blood vessels. Blood ultimately provides all the nutrition and oxygen supply to various organs which are necessary for normal functioning of the particular organ. Since the muscles of the heart continuously contract and relax to pump the blood in the blood vessels, the pumping of the heart leads to what we can hear as the heartbeat. On the average in the heart, in the healthy normal person, heartbeat is around 72 times per minute. This means that it contracts and relaxes 72 times every minute. To do such an extensive work, the non-stop without any interruption, it requires continuous supply of oxygen. For this, heart has its own network of blood vessels around it which continuously supplies oxygen to the various heart muscles. Therefore, any interruptions of the blood or oxygen supply to the heart for even a few seconds or can impair its functions and leading to heart failure or heart attack. Therefore, basically a heart attack occurs when blood vessels supplying blood to the heart are blocked. Therefore, and also now let's understand why there will be blockage to the blood vessels. The main reason behind such incidents is increase in the blood pressure and excess of the cholesterol and fat depositions in the blood vessels. Since we know that persistent high blood pressure damages the blood vessels by making them more rigid and by damaging their inner walls. Therefore, this increases the risk of cholesterol fat deposition in the blood vessels, and it will block the arteries. When there are excessive fats, it gets deposited in the inner walls of the blood vessels, like in the case of the hypercholesterolemia. It blocks the blood flow. So due to these blockages, half the person with high blood pressure or high cholesterol level is harder to pump the blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of oxygen due to the blockages ultimately lead to failure of the heart function. And so a heart attack can cause multiple symptoms. Chest pain is the most common symptoms of the heart attack. This can feel uncomfortable pressures, aching, numbness, squeezing fullness or pain in your chest. These discomforts can spread to your arms, neck, jaw or back. It can last for several minutes or come or go. However, it is not only symptoms. Possible symptoms of heart attack are dizziness or fainting like headaches, nausea, indigestion, vomiting, shortness of breath. So when you can understand about this part, means a heart attack can not only comes with the chest pain, it also comes with the abdominal symptoms as well as the palpitations or shortness of the breath in case of the diabetes mellitus. So you should understand that it is not only the chest pain which is the symptoms of the heart attack. So in case of medical emergency, it can be diagnosed by some medical tests The only way to know what you are experiencing to seek for urgent help is medical test includes the ECG, that means the electrocardiogram, which shows the functioning, means the involvement of the area where the heart attack is. Number 2 is by echocardiography. It is learned how the heart is pumping overall and what areas might not be pumping normally that you can assess from the ultrasound of the heart. Or coronary angiogram, where you can see the external blockage in the blood vessels of the heart. It is frequently recommended in the first hours of the heart attack and if the medications are not relieving the symptoms. Blood tests overall, what we usually used to do is the CPK, CPK-MB, and the troponin T, which increases more, means it is the cardiac proteins that liberates from the necrosed tissue of necrosed cardiac muscles. So when there is a rise in the troponin, so either in the form I or T, you can suspect that there is some sort of myocardial injury which is causing the heart attack. So the drug therapy, as you can see, to aim for prevent the blood clots, stop platelets from collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. How we can do this? Drugs used during the heart attack, which can include aspirins to stop the clotting that may make the heart attack worse. Other antiplatelet drugs like clopidogrel, prasugrel, and ticagrelor. The last two that you have to use it when the person is undergoing any of the coronary angioplasty to remove the blockage, or in the case of the thrombolytic therapy, to dissolve the blood clots in your heart arteries, and any combination of these. Other drugs that you can give for a heart attack are your to heart walk better, widen your blood vessels, lower your pain, and help you avoid life-threatening rhythms, like beta blocker, like the morphine in case of the pain, to relieve the pain, and any of the coronary vasodilators to increase the widen the blood vessels supplying the heart. So what about others? That means about the blood cholesterol. So you have to take the statin to decrease the blood pressure and means the blood cholesterol levels, and that should be included in the part of the heart attack also. And how to treat the blood cholesterol, that you have to understand. Nowadays, the foods higher in saturated fat are taking lots by any of the individuals because of the lifestyle. So hence it is also important to start a healthy diet to reduce the risks. Limit foods high in saturated fat, which comes from animal products such as cheese, fatty meats and dairy desserts, tropical oils and highly processed foods. Choose unsaturated fats which don't raise the high cholesterol levels. One can find and understand fats in foods like nuts, fish, vegetable oil, olive oil, and sunflower oils. The diet emphasizes increased intake of fruits, vegetable, whole grain, poultry, fish, and nuts, while curbing sugary fruits and beverages. Eating and drinking too much sugar raises the triglyceride level also, that you have to understand. And controlling the high blood pressure is also one of the main factors for reducing the heart attack. And drinking too much of alcohol also, which can raise the blood pressure. Therefore, you have to be very cautious about taking too much consumption of alcohol also, and too much of extra calories means which increases the weight gain, and too much increase in the cigarette smoking also, that you have to control because it can raise the blood pressure, and in turn again, as I have mentioned before, the harmful effects of the blood pressure. The following an exercise plan for maintaining an ideal body weight is the main features if you don't want to have the heart attack when you are in the young age. So you have to understand about these factors also very important. So regular physical activity makes the heart stronger. If one has a strong and a healthy heart, it can pump more blood with less effort during the increased risk of hypertension and heart failure. Exercise cuts bad cholesterol levels and raises good cholesterol levels, as we all know. So you have to increase the good cholesterol level. One can aim to get 2 hours and 30 minutes, 2.5 hours of moderate aerobic exercise per week, like brisk walking, or 1 hour and 15 minutes of high intensity exercise, such as jogging per week. And you also have to think about monitoring the stress levels and get adequate sleep, which are possible the best ways to prevent the heart problems. So too much thinking, too much stressful life is not good for the heart disease or to develop the heart problems. So it is important to remember that we can afford everything, but nothing is as precious as the health. It is possible to make heart healthy and prevent a heart failure and a heart attack through the lifestyle interventions. Intervention like dietary modifications and exercise. By taking action to lower blood pressure, one can help protect themselves against the heart attack. So, my dear friends, doing the regular exercise and taking the good healthy diet is more important for the prevention, as we all know that prevention is better than cure. So the primordial prevention is better than secondary prevention, which means that preventing after the heart attack. So it is better to prevent before developing the heart attack. So to every one of you, my guide is, and my species is more important of prevention of the heart attack than developing the heart attack. Thank you.